Hello, I'm Dr. Jeffrey Schwimmer. I'm a professor of pediatrics at the UC San Diego School of Medicine and director of the Fatty Liver Clinic at Rady Children's Hospital. We were asked by the editors of Clinical Gastroenterology and Hepatology to discuss our new paper titled Evidence and Recommendations for Imaging Liver Fat in Children based upon systematic review. Joining us today will be Dr. Hannah Awai, a pediatric gastroenterologist and a postdoctoral scholar in our laboratory, and Dr. Kimberly Newton, an assistant professor of pediatrics and medical director of pediatric liver transplantation at Rady Children's Hospital. Other authors on this paper were Dr. Claude Serlin, a professor of radiology, and Dr. Cindy Bailing, a liver pathologist. Fatty liver disease has become the most common cause of liver disease in children in the United States. Because fatty liver disease is diagnosed by biopsy, this has hindered the awareness of the disease as well as diagnosis and research progress. Therefore, there is great interest in the use of imaging modalities for the evaluation of liver fat in children.
We performed a systematic review of studies that evaluated imaging methods for the measurement of liver fat in children compared with liver biopsy and histology. A systematic review is a literature review that focuses on a single question and tries to identify, appraise, select, and synthesize all high-quality research evidence relevant to that question. Systematic reviews are the cornerstone of evidence-based medicine. There were 1,271 citations in PubMed, but only 182 studies that included children. From those, 173 had to be excluded for various reasons detailed in the manuscript. Based upon the evidence, we made recommendations for the use of imaging in assessment of fatty liver using the GRADE system. GRADE stands for Grading of Recommendation, Assessment, Development, and Evaluation. This system allows for clear separation between the quality of evidence and the strength of recommendations. In our systematic review, we analyzed 9 studies comprising 610 children. 4 studies assessed ultrasound, and 5 studies assessed MRI. Several of the key findings from our review include the following. First, in obese children, a positive liver ultrasound for fatty liver was correct or had a positive predictive value 47 to 62% of the time. We assess the ability of liver ultrasound to evaluate the severity of liver fat. There is not a consistent relationship between the measurement of ultrasound, known as the steatosis score, and the histologic grade of liver fat by a pathologist using liver biopsy. Review of studies using MRI and MRS revealed that there are numerous technical factors that influence the acquisition and interpretation of liver fat content. Emergent techniques need to take these into account. When liver MRI was used to measure liver fat in the assessment, it correlated well with the histologic liver fat grade and liver biopsy. However, the numbers of children studied were too few to be able to evaluate the diagnostic accuracy of MRI. Based upon our systematic review, we assigned GRADE recommendations to the following uses of imaging modalities. First, screening of fatty liver. Second, diagnosing fatty liver. Third, excluding fatty liver. Fourth, grading liver fat. And fifth, monitoring hepatic steatosis. The strongest recommendation was that the evidence does not support the use of liver ultrasound to diagnose, grade, or monitor fatty liver.
In summary, based on this systematic review, the available evidence does not support the clinical use of abdominal ultrasound for diagnosis, grading, or monitoring fatty liver in children at this time. In terms of MRI is more accurate based on the evidence available, but there's just not enough evidence. Thus, MRI technology is certainly promising, but premature for clinical use. Certainly, more research focused on imaging liver fat in children is needed. Research recommendations are provided in the manuscript for your reference. Overall, although imaging liver fat has come a long way, continued improvement in imaging technology for assessment of liver fat in children and the validation of such technology is needed and should be considered an urgent need for patient care and research.